I'm Dr. Jerry Hesch at Hesch Institute in Aurora, Colorado. I'm an orthopedic manual physical therapist, and I'm doing a demonstration on a scar. This is a technique called strain counterstrain, described by Lawrence Jones, an osteopath. And there are workshops on strain counterstrain on treating soft tissue. I don't know if there's much literature on treating scar or not. I'm going to have to dig into that and find out. I don't think there is, but here's a demonstration. So here's her scar, and you can see lines of stress going this way, especially in the middle portion of this scar. Okay, now if I capture, I just happen to treat this already, so I'm going to come here and I'm going to capture this tissue and I'm going to go inferiorly, load it till it stops and then spring it, load it, drag it up. Okay, you can see that I pulled it up and it moves that way. Then I'm going to go at an angle that way and it moves. But when I try and drag it down this way, that way, there's resistance there. Okay, so the technique involves taking a body part into the direction of ease. So this is the direction of ease, and I'm going to hold it there for 2 minutes, and then we'll retest motion in this direction. I took a scar workshop, and the focus was on massage for scars. They mentioned this, that there are indirect techniques, but they did not demonstrate it. I treated a woman, they brought in people from the community, and there was a woman who had severe burns throughout her body, but I focused on the face and treated her with this approach. And the partner next to me made the comment that the swelling along her eyebrow reduced, the coloration improved, and the mobility also improved. At that point, her eyelid was open a little bit more. And I think this is a technique that we should evaluate and see, evaluate its use for treating burn scars. Okay, so that's been probably a minute and a half. That's probably enough. So I'm going to let go. Okay, and looking at it, I'm going to capture it. It's funny. It's like the stress lines are more fine. It seems like they changed a little bit. So I'm going to pull it down, and now she has mobility in this direction. Now I can load the tissue, pull it all the way laterally. It's at a 45-degree angle. And I can even spring and get a little extra mobility now. So I'm going to capture this last little bit of it. And that last little bit seems to move freely in all directions. Now, I think, you never know what you're going to get with the technique, okay? So I wouldn't make any promises. Can you sit up and move your arm around and give me some feedback? And just keep the camera down. I haven't asked her yet. Is it okay to have your picture in the film or not? Your preference? That's fine. It's okay? Alrighty. Good. So give me some feedback.
Well, I feel like it's less tensions and I can stretch my shoulders more.
Okay.
So it's more flexible.
Uh-huh.
And less tightness for sure.
Wonderful.
Yes, it's very softer. So
good.
I feel really good actually.
I have a theory that is going to last. But your daughter can test you. Okay. Maybe once a week test it. And then treat it. It's only 2 minutes to treat. And when you start going 2 weeks in a row without it needing that, then test her once a month, and I think you'll quickly get to a place where it just stays free. So I'm not releasing the scar inside the scar. Okay, I don't think we can do that most of the time. Mm-hmm. Okay, but we're releasing tissue around the scar, so that the scar is then like a plastic toy, the bathtub toy for the kids. Now it can move around in all directions instead of it being kind of pulled over one direction. That's the analogy I use. So I'm going to do a lot more experimenting with this, and this is my first posting on it, and thanks for letting us do this.
Thank you, doctor. Thank you. Appreciate it.
Thanks.